Hello and welcome to the March 19th regular Legislative Committee meeting of the Town of Vegreville. I call this meeting to order at 3:01. I'll be looking for a motion for the adoption of the agenda. Councillor Curtis makes the motion. Is there any additions or deletions to the agenda? Seeing none, all those in favor? Carried. Next up, motion to adopt the minutes of our last regular meeting. Councillor Bullock makes the motion. Any errors or omissions within those minutes? Seeing none, all those in favor? Carried. Okay, moving on to our quarterly progress reports, and Mrs. Julia Gosling from FCSS is about to give us her quarterly report.
Thank you, Your Worship and Council. I'm so glad to be here to let you know about all the great things that our department's been working on over the last quarter. We've got a lot of amazing projects that we've been working on. But I wanted to start by just giving a little bit of background, just because a lot of the work that we do applies to our strategic plan. So I just wanted to let the public know and remind council of a little bit of our strat plan and how it's set up. So in spring of 2023, we completed that strat plan, and it has had a major impact on the service delivery that we offer moving forward. And we never anticipated how much of an impact it would really have. It's not one of those strat plans that you kind of, you develop it and then you stick it up in the cupboard and you dust it off every once in a while. This one actually sits on the side of our desk, and often our staff are reaching for that strat plan and really using it for the language that for our service delivery in the community, also with our board, our council, and then just in our meetings amongst our staff, in how we're, a new project comes up and our staff will come into our management offices and say, hey, we've got this new project, and they're using the language from the strat plan and how they're going to be delivering that program and whether it fits within our FCSS mandate moving forward. So that's been a big game changer for us. So I don't know, I don't see it up there, but the slide. We do have a slideshow here. All right, so next slide. All right, that was my intro, so the next slide. So I'll go right into the prevention spectrum. This is the tool we use to guide our service plan. And you can see that it's broken into the early stages of prevention and the later stages in prevention. And we try to stay within that early stage, so within the 1 and 2, which is before problems occur and problems are beginning to be noticeable. So that's kind of the realm of work that we try to stay in. However, the later stage, which is more intervention and crisis work, we are often called to the table to work on some of those social issues, and we'll talk about that later in my presentation, some of the social issues that have come up in the community and our role that we've played on those tables. So under our provincial mandate, though, we do that early stage prevention, and that really reflects a lot of the work, and you'll see that again in later on in the presentation. Next slide. All right, collective action. And this is really the document that our staff has really valued most in our office, that collective action. And it's really about the work that we do. So the potential roles that we could have with any initiative, and then also what level of responsibility. So whether we're the lead, we have a shared or complementary role with a lot of those initiatives in the community. All right, next. And this slide is just really highlighting the definitions of the roles that FCSS can have on any of the initiatives that we have moving forward. So if anybody were to come to our office and say, you know what, this is some of the social issues, or these are some of the concerns that we have in the community, we can say, okay, we're gonna have a look at it, and we're gonna meet as a team and decide what our role is gonna be, depending on what that might be. So this really also gives us, again, that common language to be able to communicate that to community members and agencies, what our role would be moving forward. So that's a little bit of a background of what we came up with during our strat plan.
So this is new. Like, you sort of know where everything's gonna fall now, and not
Yes.
be subject to, is the need right now and we need to do it, but this is good. I really think this is good.
This is great. Again, it gives us that language. So then when community or even the province comes to us and says, hey, we'd like you to take on this project, or we'd like you to be a part of this project, or there's this grant, do you want to take on this grant? We can look at it and say, okay, what role do we want to have in this, instead of just feeling like we should always take it on, because often FCSS is kind of the catch-all of everything, because our mandate is so broad, and our funding is based on the autonomy of our community. So this gives us it narrows it down and gives us something that we can communicate back to anybody who comes into our office, whether, again, it's agencies, the province, community members, and say, okay, this is, you know what, we're willing to be a part of this project, but this is the role that we can play in this. And it might be, and there's lots of examples coming up, but it might be where we just sit at the table, because it's not really our table. But we can sit at that table and we can provide maybe some data, some research, some background. We can advise. Sometimes we can be the coordinator. Often we can, coordinate the project. Sometimes we're the banker, and that happens a lot, actually, where we sit at the table. And often a lot of agencies will say, well, we don't have the capacity to apply for that grant, and they're all, but maybe we do as FCSS, where, we have the town, so then we're able to take on that role. And that's okay if we take on that role, but then at least we can communicate that back, that that's the role that we're gonna play, but we need everybody else at the table to also have a role in this project. So instead of FCSS always feeling like we have to always take on everything, right? So here's the shift to primary role. So again, we were doing a lot of service delivery for many years, and that was great and it worked well. But we decided, even through this strat plan and what we were hearing from the community, that we probably needed to play more of a community engagement and community development role. So we needed to make that shift from more service, the service delivery that we're doing, so that's the programs like the babysitting program, some of these direct delivery programs that we had in our FCSS, and shift more to that engaging community, bringing them to the table, also empowering other agencies and organizations to be able to take on those programs and services, because a lot of them, that's what they're mandated to do, right? They're there to provide child development. They're there to offer literacy skills, maybe seniors programs. So now we're looking at more empowering others to do those programs, instead of feeling like we as FCSS have to take on those programs ourselves. So that's more the role that we're shifting towards, and that's exactly what this slide is all about, is more that shifting. And so one of the action plans in our strat plan was simply looking at what the shift that we're making, and making sure that our staff in our office, their job descriptions were aligned with that shift. And that's why you saw our community programmers going to community development coordinators and facilitators, because that is more, that captures more of the work that we're leaning towards or that we're going to be doing in the community. We're not giving up direct delivery. We're still doing that. There's still, we have the Meals on Wheels program that we oversee and we help facilitate. We do the after hours programs, the youth programs after school with the FRN, but more in partnership. So we are still doing some of those programs and we'll continue to do them. Again, another one is the income tax program, right? We'll still do that, but we are also shifting that as well. So. All right, so we'll go to the next one. And there we go. All right, so the future focus is what the next phase was to evaluate the existing programs that we had. So during the strat plan, we had a lot of programs, and what we wanted to do was put them into different areas that were our focus within our office. So that's what we did, and you can see here that we really tried to take all of those existing programs, putting them into those different areas of service, like the focus areas. And you can see here their service plan is now broken down into 6 different areas. So next slide. Today we're going to focus on 3 because we'd be here for a long time if we focused on all 6 of them. So in the next quarterly meeting or report, we'll focus on the other 3. But for today, we're going to focus on 3, 4, and 5. And that is really the strategic goals is under the community development area. So number 3, move forward here, is the asset-based community development. And so for plain language sake, we've also added in the volunteer development and natural supports. So you can see we put in the programs and services that we're offering at that time that we did the strat plan. We put we listed them all here. So those are some examples of what we were doing in that volunteer development and natural supports. So an example of the let me see here, let me give you an example. Like, for example, creating social capital through natural supports and volunteer development. That would be like the men's shed. That's an example of what we are going to be doing moving forward. Also, adults and seniors community engagement sessions. That would be the VAST that we started, or the child care initiative. So those are some of the things moving forward that we'll be doing in that area, or that we've decided to do in that area. All right, next slide. Community social capital, and that's taking collective action. And that's through the work that we do through partnership and collaboration in the community. So we've listed them there. The FRN, we've got a soaring project, and that's a youth development project that we have. A lot of these are grants that we've received in the community, some of them. The housing and basic needs task force, also the youth center. At that time, we were applying for grants, and we had a committee together working on a youth center. Right now, that's sitting dormant because we didn't receive the grant, but it doesn't mean that it might not come up again, but as of right now, it sits dormant. And then we've got the community of practice, and that's a lot of different agencies within the community that come together to work collectively with individuals that are in crisis. So we come together, we have a talk about how we can help individuals and families. So we do that collective action, and we are the lead for that in our office. We also have the Rural Elder Abuse Prevention Coalition. That one is a regional project that we work within the region. So there's Lamont County, there's Tofield. We also have Beaver County. Viking, I believe Manville, and also Killam. So that's a regional project that we've been working on. And then, of course, our Family Day event, this community-based, and that's where many different community agencies, businesses, community members come together, and we have this amazing event that we put on. And then, of course, there's the later stage prevention support. So I don't know if you may recall that during our strat plan, these were the 44 different agencies and community members that came to that strategic plan. This is what they came up with as the community issues that were most important to them and that they valued, and they wanted to see some change. So the housing and homelessness, mental health and addictions, transportation, income equality, and then childcare and access to service. All right, so this is where my report starts, my quarterly report. Starts in terms of the action that we have and the recommendations that were in the strategic plan. Are you in the right? Oh, sorry. Can you move forward? Yeah, sorry. There it is. So in the under each area, we have our goals in each one of those areas, and then the action items that were in our strategic plan. And the first one that we're going to focus on today, and like I said, we were going to focus on 3, 4, and 5, is the volunteer and natural supports. So moving forward to the next slide. All right, so I'll give you I just wanted to give a few examples of some of the work that we did in this particular area. So one was the Ministerial Association had disbanded a while ago, and that was before COVID. And so what we did was we contacted them, and we facilitated a meeting, and were able to get them to come to the table, have a discussion about why they disbanded, and that they needed to come back to the table and you know, start working together. I think the Ministerial Association, when at a time when they were really strong, they had done some amazing work in our community, and really were focused on those social challenges that we had. And so now that they're together, they're having conversations about how they can work better together on, programs, and when they schedule programs, and also working on some of those social issues that they were once working on. So it's really great to see that they're back together. So that was one of the things that we had worked on and were able to accomplish in our first quarter. Also, the Volunteer Development Committee. So this particular project was to, just give me a second because there's two different volunteer things. So this was about working on the volunteer development, because their nonprofits are really struggling in our community. And so what we wanted to do was make sure that those that we gave a voice to all the nonprofits in our community. And so we put out a survey, and we wanted to know exactly what what their needs are. And out of that, we had 8 individuals come to the table. And what we had found out was that they're really not looking for a lot of talk about what is needed, but more education and awareness around what we need to do to move forward. So out of that, we had 8 individuals, like I had mentioned, and they're working on a project for the National Volunteer Week moving forward. So that is really good news. And then we also have our regional nonprofit development event, and that is what came out of those meetings. So we have 5 different partners. We have Lamont County, Manville, of course, our Vegreville, Viking, and then Riley and Tofield are coming to the table to plan a regional nonprofit conference that's going to be held here in Vegreville. And we're really excited about that because we've got some really great speakers that are coming to Vegreville. I believe it's in May that we're going to be hosting that. And because it's regional, we've got a lot of support and help moving forward for that. And Doug Griffith has actually said that he's going to come and be our keynote speaker for that. And he's doing it at no cost. So we're very fortunate for that he's willing to come and be our keynote. We also have a few different other groups and speakers. Jameson actually has said that he would come and speak on marketing and that's what they told me.
Told you correct.
So we've got a great lineup of speakers that are coming to talk. So we're really excited about that, and working, I guess, regionally makes it even more beneficial.
I suggest that, Manager Gosling, maybe you should invite Minister Nally.
Okay.
At our conference last week, he made it very public that he sees injustice in how gaming money is shared for nonprofits in the province. And he spoke very clearly that he is going to make some adjustments, that rural nonprofits don't have to wait as long, and there should be more fairness in the sharing.
Oh,
So he's publicly said that he is going to make some changes to make a difference for
okay.
nonprofits when it comes to pooling money and quicker times at events.
So have you heard locally how it's impacting Vegreville and kind of the nonprofits in this region?
That the wait times to get to a casino were longer.
Yeah.
We're averaging around $3,000 to $4,000 a night.
Yeah, and you've heard locally from different groups too, within Vegreville and.
I tried to get a lot together regarding the casino that was supposed to be for rural, this area that was supposed to be built. And of course, the gaming commission, their board said they didn't receive enough letters. The one from Mayor Sophie was enough to shut that casino down. But now the fact that Minister Nally had recognized and openly said that he's going to change the way that the allotment of casinos, gaming events for rural, plus the pooling of money is going to change.
Oh, that's,
I would invite him.
okay. Yes, because that directly impacts our nonprofits and our charities in our community, for sure. Okay.
And Griffin are friends too, so.
Okay, there you go. Well, we'll make sure that we put it on the agenda, the planning agenda, for sure. Thank you for that suggestion. All right, so I did, on the next slide here, I do have, what we decided to do was we wanted to give you a visual of the time that it takes for collective action. So in this slide right here, the regional nonprofit development, you can see that these conversations started in November 2023. And it's now March 2024, and, we have come to, to set a date, and we have our speakers and stuff, but collective action takes a long time. And I think that it's never easy when you're sitting at the table with others, because it's a process. As if it was just us, our FCSS planning the event, we could just go through tickety-boo and just, get a lot of this work done. But we probably wouldn't see the same impact and have the same results as having those others at the table. So it's really important that we have all those people at the table, but it also needs to be recognized that these take take a lot of time, and they take a lot of massaging, and, taking that time to also build relationships is so vital, and making sure everybody has a voice at the table. So we just wanted to make sure that council and community knows that when these things are brought to our department, it doesn't always sometimes just happen immediately. It's a process. It does take some time to get there. And in the end, the more time we take and the relationships that we build, we usually have better results as a result of that. And we're able to sustain those projects for a longer period of time. Next slide. All right. And another example of that is our the Vegreville Adults and Seniors Task Force. Again, and they have got quite a few projects on the go. They've got 7 projects that they've got. So currently, this group has no funding. They have just community members, agencies that are sitting at the table, putting their heads together, working on social issues that have come up in the community. And these are the great projects that they've come up. Now, they did apply for a federal grant, the New Horizons grant. They had applied for a project. Haven't heard back yet. We were supposed to hear back in February, but we haven't heard yet. So, but they are not even focused really on the grant at this point. They're just coming together, delivering these services, coming up with these projects, and then and you can see that on their the ad hoc transportation committee is on there. They're just, what they've done is they've taken any information that they have collected as part of AST, and now they take it to these other committees as well, just to share that information so that they can use it moving forward. So next. Again, just showing you that timeline. January 17th, 2023 is when it was established, and right now we're in March 2024, and those are and you could see the projects that were highlighted there that they had been working on. So. All right, collective action. Next. Yep. Collective action, and that is enhancing the capacity of the community organizations to deliver programs and services. And I spoke a little bit about this earlier, was that we are shifting more to that. Instead of taking on all these projects ourselves within FCSS, shifting more to building capacity within our agencies and our organizations within our community, so that they can deliver those programs within their mandate. Next slide. So, back one. The Family Day event is an example of just that, where all we did was we sent out an email, gathered everybody, set a date and a time, gathered everybody in the FCSS office to sit around the table, and they came up with what Family Day would look like. So there's 24 agencies involved, agencies, clubs, and businesses that offered 15 activities, and over 350 people attended the pancake breakfast, which of course you all know about because it was the town of Vegreville that hosted the pancake breakfast. And as far as I know, it was very successful, and it has been one of those events that I think the community looks forward to annually. Also, what was identified was that we had a lot of people coming from surrounding communities to our event. So it's becoming well-known within the region. And we were even talking in our office that perhaps it's even more of a tourism event, just because we're drawing in so many people from outside of our community. So.
It was nice to see that the county councillors that were in the kitchen with us were talking to their constituents too.
Yeah.
That were in the room, and it was nice.
Absolutely, yeah. Having that county participation as well. All right, next slide. This is another project that we talked about in our office. We often struggle as agencies in our community to know where exactly to refer others and to really know who's who in the zoo, so to speak. Somebody comes into your office and they're looking for services, and you start to look at all the different services that are offered, and you start making that call to make those referrals, and then you find out that actually they don't offer that service anymore, or no, you need to phone somewhere else because they're actually the ones that are offering the service. So what we decided is that we needed to all come together collectively and really talk about what service do we provide. Are we working in prevention, early intervention, early crisis, or crisis? So when we did send out this survey to not only frontline service providers, but their managers as well. So we sent them separately a survey, and you can see this graph in the corner here. You can go to the next slide. We sent this out to them and with a survey, and we had them place their organization in the different category. And it was so interesting to see where agencies place themselves on this chart. It was actually really cool. And what we found out was that we had a lot of people that were putting their agency right across the board even. Like they would say, yeah, we do prevention, early intervention, we do early crisis, and we do crisis work. We're like, oh, wow. Like a lot of us were just blown away by that. We didn't even know that's how they categorized or defined the work that they did in their office. So when we completed this, we had everybody come to the table and we had a conversation about it. So we blew this up, had it up on the wall, and it was really interesting to find out what people defined as prevention. And after all of that, and we got to the root of it, what it came out was that different ministries had different definitions for prevention. So we were finding out that we were getting referrals to our FCSS office based on their definition of prevention, because sometimes we'd sit there and say in our office, why are they referring to FCSS? That's not really within our mandate. But by their definition, it actually was prevention. So it was really cool to see us all go, oh, aha, we all understand now that our ministries actually have different definitions. So they are going to be working on their own definition within the community of what prevention is, what intervention is, what crisis is, so that we all have this common language around where we are going to be making those referrals moving forward. So that's really exciting work amongst our agencies, and it's really setting up success for the people that we refer, where we refer them to, also efficiencies within our organization. So we're not having to send them to 3 or 4 different places. If we all have a common, just language or definition of what that looks like and what those look like, and we know where people are putting themselves, it'll be just so much easier. So they loved it. Agencies love this work. They're going to continue to do it. We ran out of time to actually get to the end of it. So what they're going to be doing is working on it during the next interagencies, phase 2, and we're hoping to have a document with a common language in it. So
did you see differential in federal and provincial, what they would say was intervention? Agencies?
I don't know if it was much federal. I'm trying to think in our community who would have been sitting at the table that was federal. I don't know if we had a lot of federal agencies, or maybe they receive a little bit of federal funding, but for the most part, it was provincially funded agencies that were sitting at the table. But there was something else that I was gonna say that about that. It'll come to me.
I would imagine didn't fall within, they were told, no, that's not exactly what we do, that's not exactly what we do, they would probably just give up.
Exactly. Yeah, that was a lot of the challenges. There's also a lot of turnover within, this field of work. Burnout, quite often, people move. And so that is a bit of a challenge too, right? Because you just build a relationship and you find out the work they do, and then they move on and you're starting all over again, and they're just learning what you do and the work that's happening in the community and the services that are offered. So that's a bit of a challenge. But what was really interesting is that in some cases, the managers were filling out the survey and the frontline services provider and they have different answers for the delivery. So the manager would say, oh no, we're just working in this area. But the frontline service provider was actually doing a lot of the work that wasn't even in the mandate, because we're all stretched like rubber bands, right? Everybody wants to, if you get into this field of work, you just want to help people, right? So you end up stretching yourself and working outside of your mandate. And that's what we were finding too, is that the frontline service providers were actually working outside of their mandate because sometimes also you build that relationship with individuals. So then they just want to work with you. They don't necessarily want to be referred to another agency. So those are conversations we'll be having too as we progress through this project. So.
This project is on your own. You're not looking at some other communities, how they've done it. Do you know anybody else that's doing this as well?
No.
So eventually when this thing gets buttoned up here, it's probably something that we could actually share.
I'm just going to look back at Teresa because we were having that conversation today. We actually said this is something that we could present to the FCSSAA and do a presentation at a provincial level for sure. This work that we're doing, yeah, and taking it to our ministers and saying, hey, maybe we need to have some common language amongst our ministries as well. So, yeah,
Good job.
yeah, absolutely. Next slide. And then, of course, another example is the youth-led community initiative, the Soaring grant that we received, and that's all about empowering youth in our community for collective action. So we had 16 partnerships involved in that, and there was we connected with 30 youth and 20 different agencies for this project. This is a project that we got started. The youth got really excited about it. They were they kind of picked their project, and summer happened. And then the project kind of, youth kind of lost a little bit of interest. The project seemed like it was a little maybe more than they had originally thought it would be. So this is an example of sometimes the project doesn't always work out the way you intended it to. However, Latanya was able to pivot and go back to those youth, re-engage them, bring them back to the table and say, okay, maybe this project is not going to work at this time, but is there something else we can do within our capacity? And she was able to do that. So you can see here, the next slide. They were able to do that pivot, and now they do have a project. Next slide. And they're doing some intergenerational cooking classes within our community, and it's youth driven, so that's the main thing. So they're also going to be doing some mini workshops. So they decided that was something that they would really like. And one of the workshops that they wanted was to learn how to talk to their parents and engage their parents, because they're finding right now that it's really difficult to talk to their parents about some of the mental health concerns that they have, or some of the issues that they're dealing with, that their parents seem to be almost dismissing their concerns. So Latanya is going to bring in a guided path. That's the counseling agency that we had in our office. They're going to come out and talk to the kids about how they can talk to their parents. So that's the project that they're going to be doing, which is really exciting. So the success in that really was that just because a project it doesn't always work the way you intended. If you're willing to be open-minded and accept that and pivot, some really great things in the end can come of it, even though maybe it's not what you intended in the beginning. So, yeah. All right, and then also the volunteer form assistance clinic. As a lot of you know, we were doing form assistance in our office. It was one-on-one. Individuals that come into the office, mostly seniors would come in, and we do a one-on-one with them to help them with their form assistance. And so what we thought is that instead of just, because it takes a lot of time, that one-on-one, and as you know, we're trying to move from direct delivery more to that community engagement. We are piloting this form assistance clinic where we're empowering individuals to fill out their own forms. So these clinics, a number of different individuals can come to the clinic. We'll give them some education on how to fill it out. We'll have individuals that will go around and help them with any part of the form that they need filled out. And that way, we're empowering them to do whatever they can do in the form, but still being there to support and help them with the parts that they can't fill out, and helping multiple people at once instead of just that one-on-one. Mm-hmm. Yeah. Yeah, it is. Yeah. Yes, it is mostly the provincial forms and federal forms that it's usually seniors forms but it could be anything that's requested based on what the need is. We don't do a lot of AISH forms currently, and we're not really supposed to do AISH forms. It's kind of a mixed
It's going to be
message
based on the skill set of the volunteers that are there, are then going to.
You won't be able to be heard.
It's going to be based on the volunteers that'll be sitting at the table and their comfort and skill level to fill in those forms. So from an FCSS standpoint, of course, anything that was provincial, that's where we can provide that knowledge.
Yeah. All right, next slide. All right, and the last area that I'm going to go over is the later stage, or the intervention and crisis prevention, that building social capital in our community. So this area is those different areas that the community, different agencies in the community identified: the housing and homelessness, mental health and addictions, transportation, the income equity, and then also childcare and the access to service. So this area, because this is a later stage in that intervention and crisis, our role would be more around that guidance and support. So this is more long-term strategies where we're involving community or even a region. Okay, so next slide. Oh, next one. Again. Oh, sorry. Go back. And then back again. Back one more. Yeah. There we go. Is there one with just the one, Jameson? Yeah, that one. Yep. So you can see here in this slide that the town's potential role is primarily advocacy. So we play more of that FCSS. We we play more of the shared and collective action role in the later stage prevention. And the town was identified as having more of that advocacy role moving forward. And then it could also be in the planning and regulatory as well. All right. And then the recommendations moving forward is were brought forward by our consultant was the social development strategy, community services leadership, and then also regional collaboration. And next slide. All right, so here's some examples of the work that we're doing right now in this area. So building capacity within our community around child care committee, and of course that has come to council a few different times, and I know we're having conversations even at a provincial level around child care in our community. But what's really great is that Latanya has been able to bring community members together, and along with some of our agencies, our local agencies, to have this conversation. And they've actually done quite a bit of work in this area to gather a lot of data and research. And they continue to meet to work on this project. So, and I know Town Council has also said that they're willing to take on that advocacy role in this particular area, and you've been working on that, so we appreciate that.
And we did hear some changes on the pay model moving forward, that the province has announced that they would like to get money in the hands of these providers faster with the federal program.
Yeah, we did, Sandra did send that to me, and I think that we were gonna take, is that the one that the email that you had sent me? Yeah, so then, right now, will go to the committee, and they'll have a conversation about the steps that they'll take moving forward with that, so. Yeah, I think it's really important that we still maintain that role, that we have this more community-led. And so everything that we receive from the province, we'll make sure we take to that table and have a community discussion about that, and then bring it back, and we'll bring it back to council and say, okay, now this is what we need moving forward, so, yeah.
I think it's very important in a business plan, and a business model moving forward, if you have access to funds 60 days or 70 days faster than what you had before, it changes your business.
Absolutely. Yeah, you're right. It's a game changer. Okay, and then next slide. And then, of course, the Housing and Basic Needs Task Force. Just recently, we have partnered with, well, the food bank actually sits on the Housing and Basic Needs Task Force, but what we've done is we've worked with them on moving that grant that we had from the Rural Development Network, moving that over to the food bank. So moving forward, they will actually be taking on that role, taking on that grant, and then it will also have a coordinator moving forward. So that's a success story moving forward. Next slide. And then another example of that is the family and domestic violence, improving access to services and strengthening the nonprofits. So we have agreed to take on a grant for a short period of time for 1 year, and then also for the Crisis Association. And after 1 year, we're hoping to be able to give it back to the Crisis Association, and that's all around the family and domestic violence. And so at that time, we also brought trusted agencies to the table so that FCSS wouldn't be doing all the work for this particular grant, but also working with different agencies so they can help deliver this program and get the money into the hands of the people that need it, though, or not necessarily the funds directly, but the services or the resources that they need, whether it be transportation or a hotel, also maybe some food. So we're keeping the pot of money, but we've got our trusted agencies in the community that are able to access those funds as well. So it's not just FCSS. All right, and then our last slide, or second last slide, is just, we just wanted to give you, so next, and yeah, is the estimated grant contribution. So as of this month, March 2024, those are the current grants that we have right now as we speak. So this does not include the town of Vegreville's contribution, is not included in that. So our grants that come into Vegreville is just over $500,000 that we have in grants that are in our community right now that we hold through FCSS. That does not include the grants that we've applied for that we currently have not heard about. So we've applied for a counseling grant, which is about $82,000. We also have applied for some youth counseling, a grant for youth counseling through the Canada Post grant. And then there was another one that we had for around $80,000. I think that was...
That's like the social worker 2 position through crisis.
Oh, right. And then we're also applying for a social worker through so an increase in the current grant that we have, the crisis intervention grant that I spoke about for family violence. We also are going to be applying, or we are just in the process of submitting a grant increase for a social worker in our community. And we haven't heard from that. Oh, and I also had a phone call, and I'll be meeting with the CAO of the Calgary Counseling Center. The CAO wants to speak to me about the grant application we had made to the addictions and mental health, and that was for the counseling program. So I have a meeting with the CAO this week to have a conversation about that. All right, and so I know that was a long presentation, but the final slide is just around our next steps. So we are going to continue to work on our action plan and recommendations as outlined, and of course there's 3 other areas that we'll go over in our next quarterly report. And I just wanted to point out here, these pictures here that we have, that was our team did a presentation at the FCSS AA conference on our strat plan, and it was well received by many of the people that were there. A lot of directors were very intrigued and interested in our strat plan and the work we're doing, so we're really excited to be able to do that. And that is it. I know that was a lot. That was more than 20 minutes. As usual.
Is there any questions or any comments?
Your mics are having problems, we'll have to recess afterwards to address the issue.
Okay, just if they hear it after, it's fine, these guys will hear. So,
Okay. Yeah.
I was on prior to really you guys getting a chance to implement it, so I'm glad to see it worked out as good as it has been. I typically don't like surveys, and I don't like consultants for the very fact that they're useless. We literally shelf them and spend money on it. So I liked right from the beginning when you were planning this, that it was gonna have numbers attached to it, and something we'd actually be able to use for planning purposes. So I think that's really, really, well, it's great to see that it's helping you guys guide along. You guys are a little bit sometimes like mother birds that don't want to have to look at a problem and say, oh, well, you need this and this, you want to jump in and do it, and that's a great thing, but this gives you a tool to be able to explain to people why you can't just be the one providing that all the time. But it also does another thing for us, if you guys are keeping some of the stats and the information, is that the projects that you're saying you can't necessarily do because it's not falling furthest on the mandate, but you might know it's a high need. Those are the things, if you come back to us, allow us that advocacy piece back. And as you see, we've advocated on a few issues and
Yes.
had really good success with it. But the biggest thing we need is to have that mandate and stay in it. And it's not because we don't want people to get that extra service. It's because whether we're talking provincially or at federal levels, if we go outside our mandate and just do it, then it becomes the norm for it to expect it to be done. And we then need some resources to do that, or we need, you know, the mandate to change a little bit. So it's important to see that. Definitely the description, as you mentioned, I thought was really important to know those descriptions, because we had that discussion when we talked about something as simple as homelessness. And we discovered that a big problem in what we were both looking at for an approach was the fact that federally they were looking at homelessness on a stance of being basically anybody who didn't own a home or have their name on a lease. But what we're advocating for, so that was something we ended up talking about, because on our level we're dealing with what we're talking about being the homelessness in the streets and working with the province and trying to address that. But some of those federal grants are talking about it more on a line of like affordability type of homelessness. So the fact that you're taking another program and really putting definition to it, I think is gonna help a lot. And I think it is something, our FCSS has been recognized multiple times by the province for leading in a number of items. So the only last piece of data, I just wanted to mention that the more data you guys can always gather with, I know you can't get personal people's information, but the more times you can identify where they're from and what communities, that's gonna help us a lot going forward. Even something as simple as, you mentioned the Family Day event. It was wonderful for you to say like how well it's doing, it's becoming a tourist thing, and that might be a shift that we discuss. But it is, right now, we look at it as a way that our council, along with one of our biggest partners being Minburn County, each put in some resources of both some financial and the time of everyone, and try to give back to the people of the community for Family Day. But if we start to notice that this is becoming a thing that people are attending from all outside places, that's not a bad thing, but it may shift the conversation, because Vegreville and Minburn County can't always be the banker to provide programs to all kinds of outside, unless we can show that it is a tourist item that then is, you know, helping our businesses and whatnot. So the more often we can gather that data for us, we have had conversations around recreation and other items that have said, if we're going to move forward and Vegreville is constantly gonna be that hub, we need that data to be able to go to the other partners in the other counties and say to them, and I know the province is advocating for that, so working together, working in big regionals, but sometimes Vegreville area gets put on the financial hook for a round, so I appreciate you guys gathering that, and the more you have, the more you're gonna help us. Oh yeah, don't shut it off, Dick.
That's good.
You don't turn your mic on.
I can. I just want to thank you all for coming in and presenting this. I've been on the SCSS board for a while now, and it's nice to see this flow through, and as Councilor Rob said, sometimes strat plans don't do you a lot of good. I think this one has, just the fact that you're out from under the programmer, I think it really shows that you have more time to do more, because you're giving that the role that you're in, where you're helping and you're setting things up and you're moving, like, it's, the amount of stuff you guys have going on here is awesome, so just wanna throw that.
Yeah, we actually have a document with everything in it, so we'll make sure that we provide that for everybody, for all the council to see, because it really is overwhelming how much is going on in our office. I'm telling you, that strat plan created like new energy in our office collectively, because just the excitement around getting out in the community, engaging community members, having direction. And again, I can't say it enough, having the language to be able to say to community members, this is what we this is what we can do, and this is how we can do it, is a game changer, like I said, so.
It means,
yeah.
you're not saying no, you're saying this is.
Exactly.
This is where we stop, this is
Yes.
what we can do.
Yes,
But this is what, we can still get you that, it just may be through a different avenue.
exactly.
All the stuff we've set up is allowing
Yeah.
that to happen.
Yeah.
I don't know what secret formula you guys have for grant writing, but don't give it out to everybody else.
Councillor Bullock.
One of the things I really like is the continuum services and where does the organization operate? And I think just bringing it out to everybody to kind of show them where they're operating and where they should be and where they shouldn't, I think will straighten or help straighten out a lot of doubling up and even downloading.
I tell you, community, that was like a light bulb for them, or a lot of our agencies. They went, wow, Like, this is great. And to be able to speak about it collectively, like everybody sitting at the table and just bringing it out and saying, okay, let's have a conversation about what our definitions are. And, you know, there was a little bit of banter back and forth as to what the definition, but at least we're talking about it, right? So I'm really excited to see this project come to, you know, where we have a report and we can share that with others in the community. So yeah, it's a great project. And like you had said, Tim, we're excited to share it also
Well,
with others.
thank you.
Yeah.
And I just want to say that congratulations on your strategic, not just plan, but the shift and the language. It just defines what your role is. And I would encourage you to let all the other FCSS organizations that you're going to be meeting with when it comes to nonprofits,
Yep.
if they could write a letter to, have the nonprofits write a letter to Minister Mallard regarding the unfairness that's in how gaming proceeds to help him along.
Okay, well, I did send that information when you and I spoke about that before to the FCSSAA, so I'll find out whatever it came of that, or if that's something that maybe we can send again, but,
Yeah, just the more encouragement that the minister gets, the faster you'll make. Okay, thank you very much.
yeah, thank you very much. Thanks so much for having me.
We're going to take a 5-minute recess while